So hello, everyone. Welcome to our event today. My name is Marinka Rojas-Gorgon. I'm a member of the leadership team for NAAAP San Jose, along with Noel Blanco and Annabelle Ambion, who are all joining us, and Aaron Mark is just signing on as well. Really excited about this event. NAAAP San Jose has a very active wellness program that we call BeFit, where we look at not just physical fitness, but also mental fitness. So this fits in perfectly with that theme. If you're not familiar with NAAAP San Jose, we're located in San Jose technically, but we actually do events all over the Bay Area. So we know how hard it is trying to get around the Bay Area. So it's just easier to do things in the East Bay, North Bay, up on the peninsula. We move things around. So you can always check our website for our latest events. We also have a very active Facebook and Instagram as well that you can check in. Also LinkedIn. For today's event, we are very happy to invite some people who are here actually from the East Coast. Let me go ahead and introduce Angel Wang with Anise Health, and she will go ahead and kick off the event. Angel, turning over to you.
Thanks so much, Marinka. Thanks so much, everyone. Hello, NAAAP. We're super excited to be here. It's been so wonderful working with Marinka and Noel to plan this event. Y'all are really lucky for their leadership. We're grateful for the opportunity today. Our topic will be generational differences in mental health, and it's a very timely conversation given that July is actually Minority Mental Health Month. So by way of introduction, my name is Angel Wang. My pronouns are she, her, hers, and I'm the head of growth and partnerships at Anise Health. Anise is a culturally responsive mental health platform built by and for the Asian community. We work with a broad network of specialized clinicians who are dedicated to empowering Asian individuals, such as our honorable guest today, Dr. Nadine Chang, is a leading expert in the field. So Dr. Chang holds a variety of special certifications and positions. She's the chair of the Asian Psychiatry Program Committee and a training director of the Clinical Psych Externship Program at Gracie Square Hospital. So I'll invite Dr. Chang to explain a little bit more about herself and then share a bit about Anise. So Dr. Chang, do you want to do a quick introduction?
Sure. Thank you so much, Angel and Marinka and Noel, for having me. I'm very excited about this. Just a little bit about me. I am a clinical psychologist here at Gracie Square Hospital in New York City. So I'm on the East Coast right now. And a lot of what I do is training future psychologists in evidence-based treatments for inpatients, so people with serious mental illness. But another arm of what we do here as part of our Asian psychiatry program is we do a lot of community outreach. And so we were lucky enough to receive a grant about a year and a half ago to fund community outreach efforts to provide mental health information to AAPI communities. So we've been very busy the last year, doing a lot of outreach, doing a lot of in-person and virtual talks and workshops just to spread information about mental health and how to seek support if you or anyone you know needs help. So I'm very, very happy to be talking to this group today. Thank you.
And I see in the audience, Shin Ling is with us. She's also one of the community outreach managers. Super grateful to have been able to work with her. So Anise Health, just want to share a bit about us, since part of our care journey is offering professional resources. Today's event is brought to you in partnership with NAAAP, Gracie Square Hospital, and Anise Health. So with Anise, our clients benefit from 4 distinct advantages that are more tailored for the Asian community beyond one-size-fits-all wellness solutions. So first, Anise is the only platform that's focused on providing culturally responsive care for the Asian community with an integrated care model that combines both therapy and coaching. So clients on our platform get a dedicated care team that's focused on creating personalized journeys, treatment plans with them. And our expert providers are focused on Asian patients and are trained in our proprietary evidence-based curriculum. The second one is that our data-driven and tech-enabled platform allows for personalized care plans and tailored recommendations. We also have an extensive digital resource library that's curated to each individual's journey. Third, Anise is accessible and affordable. You can get matched to a provider within 2 business days, and plans start at just $50 a week. We accept HSA and FSA benefits, and we're in network with MHN and Optum if you have that as your insurance. I know when I was looking for a therapist, my private practice therapist was $150 an hour, and her wait list was over 2 months. And finally, we have a really amazing, thoughtful community with extensive nonprofit partner relationships, partnerships with Asian advocacy groups, and referral partners to other healthcare organizations too. So on the left is just a snapshot of some of the providers we're super lucky to work with. A lot of them are multilingual, they have different types of credentialing, and our results are really humbling. So 97% of our clients complete the first 4 weekly sessions, which outperforms industry benchmarks where people of color are actually 50% more likely to drop out after the second therapy session. And then 80% of our clients continue on past the second month of care. And just after 2 months, our patients experience statistically significant reductions in symptoms of stress, anxiety, and depression. So we'll put that out there. I'll share some links about Anise. And I'll also put a post-session survey form where people can sign up to learn a little bit more about Anise. But without further ado, we have an event ahead of us. We're excited to continue normalizing the conversation around mental health in Asian communities. Today's conversation is not a substitute for individual therapy. It does incorporate some of the research and psychoeducational principles that are foundational to growth and learning, but it's not therapy. To frame our conversation, we'd like to remind everyone to be respectful and curious about each other's perspectives. There's no wrong answers. Feel free to ask questions in the chat. I'll help monitor as Dr. Chang gives her presentation. So we encourage everyone to be courageous, to show up, and be brave. So with that, I will turn it over to Dr. Chang and let her share her slides for the presentation. Great. Dr. Chang, you're on mute, and we're currently seeing the title slide.
Sorry, let me just move forward. Hold on. Sorry, I had queued it up to you. There we go. Here's me.
Great.
Okay, thank you. Hi, everybody. Again, I'm Nadine Chang, clinical psychologist here at Gracie Square Hospital. And thank you for introducing Shunling Chen. She's our community outreach coordinator, who really does the legwork in terms of maintaining relationships with community organizations who are looking for mental health information. So thank you, Shunling, for everything that you do. We wouldn't be here without Shunling, so this is great. I always want to start with just talking a little bit about where I'm coming from and where we're coming from as Gracie Square Hospital. So we are an inpatient psychiatric hospital in Manhattan in New York City. We've been around for about 60 something years. And about 20 years ago, a little over 20 years ago, we developed an Asian psychiatry program, and it's an inpatient psychiatric unit that is tailored for individuals of Asian descent who need psychiatric inpatient treatment. And so we do have specialized program tracks within our whole hospital, with our Asian psychiatry program being one of them. And what sort of stemmed from our work with our inpatients, and these are, individuals with serious mental illness, we work very closely with their families. And in working with their families, we realized that there's so much need for information in AAPI communities. We had so many questions from family members and others. And so that really prompted us to do a lot of community outreach, which just exponentially increased during the pandemic. We had many requests to talk about mental health and just the impact of the pandemic on mental health and especially AAPI populations during that time. So I'm very grateful to be able to speak here, but I just wanted to give everybody an idea of where we came from and how we started our community outreach. Okay, so today we're going to talk about generational differences in mental health and approaches to mental health. And I will say that as I'm talking about these generations, these are in the US, right? And very generalized. And I think if we're thinking about whether it's ourselves, I don't know the age range of who's attending, but if we think about ourselves and our family members and others we know, thinking about the generational differences in terms of age, but also age if they immigrated to the US, age of immigration and when that immigration occurred. So all of these things we have to think within these contexts. So I'm giving broad overview right here of US generations. So I will be talking about each of these generations in more detail, but this just gives you sort of an overview of the 1920s until the present. Sorry, I don't know if I clicked on something. Okay, there we go. Okay, so if we think about the 1920s to 1940s, traditionalism, I'm going to highlight, these areas that sort of describe generally these generations, so values, family, education, and communication, and finances. So if we think about a sort of traditional generation as respecting authority, following the rules, maintaining a traditional, what traditional meant back then, traditional family, dreams of education, because we know education was not attainable by everyone back then. And then if we think about how they communicated, phone, in person, letter writing, and then in terms of finances, the values were, save first, pay in cash. If we think about the 1930s, right, and finances were very, devastating to so many people. It's just sort of like being cautious and conservative, right? Okay. And then if we sort of move towards what's called the baby boomer generation, 1940s to 1960s, you see a little bit of shift in terms of values, in terms of optimism and participation, and then more team-oriented, less sort of individually oriented, more team-oriented. We did see more families that were divided, and education was looked at as a privilege. And then we also had different types of communication, including, push button telephones, which many of us may remember, calling people, just calling anytime. Think about how we do that now. It's so different. And then there were differences in finances and values within financial decision making in terms of maybe buying now and paying later, putting it on layaway. Remember what layaway means. Okay. So then we come to more recently, Generation X, was like 1960s to 1980s. This we see a sort of a big shift. Values, we can say, some may different opinion, but skepticism, hedonism, individualism. We see more, again, divided families, and then children who were more independent at a younger age, maybe. Education was seeing as just the next stage of life, as like an expectation, as opposed to a privilege. This is when cell phones are a little bit earlier, or a little bit early for cell phones, but they did exist in that time. Or just call me later, call me at work. And then we see financially sort of spending more carefully, conservatively. During that time, there was more education about investments and savings. Okay. Then we come to, I don't like this term, but it is a very widely used term, millennials and Generation Y, where again, it's a little bit of a shift of more self-confidence and values, valuing enjoyment. We did see more social consciousness during that period. Integrated families, meaning like not necessarily traditional families, not necessarily divided families, but integrating family systems. Education started to be seen as expensive expenses. I think during that time, if many of us were in college during that time, we know that tuition skyrocketed during those years. And again, advent of the internet and smartphones and email, and so communication differed drastically during that time. And then a very common approach to finances is, you know, as long as I can afford it, I can spend it, right? So spend as much as you earn. And so that leads us to now. And so where are we now? I don't have answers to that. But I guess we're seeing how, you know, values, family values, education, communication, all of, and even ideas about finance have changed so much over time. So these are things to keep in mind as we're talking about the needs of different generations, and specifically how this affects mental health needs and beliefs about mental health across generations. Okay, so I'm giving you a couple of scenarios here just in terms of like generation gap and in values and beliefs. So an older person, and I am providing examples from a very generic Asian American belief system and value system. So if the older person is saying, how can you get a job when you don't look professional? Are you serious about your work? Again, sort of like the traditional values and ideals of work. And then the younger person saying, being fashionable doesn't have to conflict with my work. Another question might be, why don't you have a stable job yet, right? And again, the more traditional views of work and, you know, and stability. And then the response is, I'm a freelancer. And I don't know if you've experienced this conversation before, maybe some of you have, but I'm a freelancer. This is still a job, right? But to an older person, this may not seem like a normal, stable 9-to-5 job, right? Back in my day, I had been working every day since I was 14, right? And the response could be, well, I'm still running my own business at this point, even if I didn't start working at 14. Some of these might sound familiar to you. Definitely sounded familiar to me. I called all the restaurants in this community to find a job, right? And then the response, a little snarky, saying, it's 2022, no one has done this. And again, the change in the work culture and atmosphere is so drastic, right, from across generations, that even 10 years ago, I think job seeking was very different than it is now. Why don't you take initiative to contact famous companies? The company interviews are different than the old times. Definitely, I've heard this question, not to myself, but to someone else. Like, why don't you just email Google and ask for a job? Not that easy, Dad. And then you need to save more money. Again, that, you know, the value of savings, right? To have that sort of cushion, that nest egg, that, you know, just for safety and you know, sound mind. And then comparing that to the perspective of, I have enough money to support myself, I'm fine. Right. So that's just, you know, a couple of these examples of different values and different ideologies in terms of employment across generations. Okay. And then when we talk about mental health, keeping these values and ideologies in mind, the older person might be saying, of course I feel fine. There's nothing wrong with me. Of course, everything's good. Everything's great. Right? And you think about what's sort of underlying this, right? It could be just, I am self-sufficient and don't need anyone else because I'm an independent person and I have these traditional values and that's that, everything is good. Stiff upper lip, you know, and then there's nothing wrong with me because of stigma or because if I show any sort of vulnerability, then that means I'm not living up to my responsibility. Versus, I mean, we still see this in younger generations, but I do feel like with all of this outreach that is going on, especially over the last 5 to 10 years, getting mental health out in the public and in normal conversation, this younger person might be more likely to say something like, sometimes I feel like I'm not good enough, even though I know there are things that I do well, right? And this sort of like, am I good enough? I know I have some strengths, but I don't know if I'm living up to my potential or living up to my the expectations, right? And younger people might be more apt to talk about these insecurities than an older person may be. You may think of people in your own life that sort of fit these molds right here. Okay, I also want to talk about gender differences in values and beliefs, because that also, I think, varies across generations as well. And again, very generalized here, but I'm just, saying just as an example. So for a male who may be head of the household, keeping in mind this paternalistic family and social values, the person may value success and strength, and at least appearance of success and strength, might be less sensitive to others' emotional needs because success and strength is the primary value, right? But underscoring all of this may be that his mental health needs are secondary to his household and family responsibilities, right? As the head of household, we say, right? So let's compare that to a female figure in the household who traditionally may be deferential to paternalistic values, value success of the family as a whole, as opposed to individual, might be expected to uphold traditional responsibilities, even if in this example, in the image, she may be a doctor. But in the end, similarly, mental health needs are secondary to household and family responsibilities. So we see that sort of same hierarchy of priorities. And so what we're seeing more recently is that these younger generations are actually sort of needing to decide how to balance these traditional values and newer cultural values and the expectations for themselves and their family roles and responsibilities and home and family and work. So, so I think this is a struggle for a lot of younger people who may have grown up with traditional, parents who had traditional values, and then like balancing it with like more, I guess, more like Western or acculturated values. Okay, so I do want to sort of give an overview of what is mental health, just so everybody is on the same page, because not everyone knows. And again, thinking about, even if you are familiar with this information, thinking about people in your life or colleagues who may not be so well versed in mental health. I think that's something, a lot of what we aim to do is share information with our participants, but hopefully our participants will share this information with others too. So mental health in general is overall mental and emotional well-being. And what that means is feeling relatively good. I mean, you don't have to be happy 100% of the time, but relatively good about life, even though there may be stressors in your life, right? Reasonably. So mental health is not having no problems at all, because we all have problems sometimes. It's not feeling happy 100% of the time, because nobody does. It's not always having positive thoughts or being perfect, right? So acknowledging that there are some stressors, there are some, negative aspects of our experiences and even how we think, but not necessarily impacting your daily life in a negative way. Okay, so we'll compare that to mental illness, okay? And mental illness, a lot of times people think about it as like the most serious of psychiatric disorders, which is what I do work with. But mental illness, we can think about like a broad scope of illness here. So we can think about it as when it does get to the point where it is an illness and it is affecting your life, think about it, it is a brain disease that impacts how you think and feel and act, usually in negative ways. It makes it hard for you to live your full life, and can be caused by multiple factors, including genetics and brain injury, biochemistry, traumatic experiences. So there's no one reason for someone to have a mental illness. It's always a combination of factors. But I always want to say it's not because of bad parenting, which we hear a lot. Not something that you can just get over. Oh, just get over it. You'll feel better. Just look on the bright side. Not that simple. And I really, this is very important to me and my advocacy is it's not just the people who are dangerous. People with a mental illness are usually not dangerous, actually. And so I want to combat that stigma in everything that I do and say. Okay, and I want to give a little bit of statistics in terms of mental illness, just so everyone is aware of how common it is. And I talk about this a lot in order to provide education to everyone, as well as to battle stigma. So about 1 in 5 people have trouble with their mental health. So if you think about 10 people in your life, maybe 2 of them have something going on that they're having a hard time with, right? That's almost 44 million people in the US. Think about it in terms of it's more common than people who are left-handed. I like that comparison because it is very common and it's just people, a lot of people don't talk about it. And so that's why we are here to talk about it. I wanted to point out some, again, age differences in mental health treatment. So if you look at the dark blue column is the rates of people seeing a psychiatrist. And we see that older adults have the lowest rates of seeing a psychiatrist. And this sort of makes sense if we think about, again, like the traditional values of like independence, self-sufficiency, especially if someone is, you know, an immigrant to the US. And here I am, how many times have you heard the story of like, I came to the country with $50 in my pocket and I worked my way from there to where I am now, right? So that's a lot of, you know, self-efficacy and a lot of, and also pride, you know, in being independent. And so it very much, I think, makes sense that older adults have the lowest rates of seeing a psychiatrist. There's still so much stigma, and that stigma doesn't really go away with, you know, especially as people get older, they still hold on to those values and beliefs that they had earlier in their lives. So here's another graph about types of mental health treatment across age groups. So we see that older adults, again, have the lowest types of any mental health treatment, and especially therapy. And I do work with a lot of older adults here in the hospital. And I will say, you know, how many 70-year-olds have I seen that's their very first time in therapy? Because this is just not what's done. And it wasn't okay to talk about your feelings. And it was a source of shame. And so again, these rates are not surprising, but it just also highlights the need, especially for this generation of people. So we see young adults have the lowest rates of medication treatment, but the highest rates of therapy, psychotherapy. So this sort of shows the shift, right, of, okay, maybe not taking a lot of medication for mental health issues, but instead going to therapy and seeking therapy as a main source of treatment, which sort of speaks to, hopefully we are normalizing mental health and mental health treatments more recently. And so younger people are more open to seeking therapy, but also talking about therapy and seeking therapy. So I'm always happy to see that. Okay. All right. So I do want to talk about differences among service utilization. So this may not be a surprise to you, but AAPIs have the lowest rates of mental health service utilization in the US. Again, there's so many factors involved with that, including stigma, but also availability of services. And so at least in the last 10 years, we've seen a huge rise in at least efforts to improve resources, education, like community outreach that we are doing here, and then developing treatment programs. One is even just like language accessibility and encouraging more people who speak other languages to sort of join the mental health efforts, and also developing culture-specific treatment programs like our hospital has, as well as just educating the public on what resources are available. And that is a lot of what we do in terms of our community outreach. This is who you can call, this is where you can go, this is what you can do. Yeah. So putting all of this together, we see US mental health care utilization already is sort of low to begin with. And then we look at older adults, which are again, low. And then we look at AAPIs, low. So if you're an older Asian person in the US, you're gonna be in the smallest category of receiving mental health services. And so a lot actually of what we do as part of our community outreach is we do seminars for senior centers in Asian communities here in New York City, so like Chinatown and Queens and Brooklyn, and we do provide this information in Chinese dialects, and we did one in Korean as well. So we're really trying to target a very underserviced community with this information. And thankfully we are having people attend, because I was afraid that people would be so stigmatized by the topic of mental illness that they wouldn't even come to the seminars, but we are getting good attendance. So that's really great. And I think just one thing, I don't think I put it in this presentation, but just talking about access to services, you know, the pandemic with the pros and cons about virtual services and, you know, virtual resources, that at least we are able to provide information to people across the country, across the city, in their languages, and they don't have to travel to Chinatown or travel to Queens. So that is one little silver lining of the pandemic, that it's actually allowed us to improve access to mental health information. And especially for our older people who it's hard to travel in January in New York City. Okay, so talking about possible barriers to mental health treatment, MMO already talked a bit about stigma and a bit about access, and all of these points here, you know, are dependent on not just generational status, but also acculturation level. And again, I was talking about like age of immigration and just personal values and beliefs. Obviously, a lot of people feel uncomfortable talking about their feelings. It's quite vulnerable to do that. And so and that's why we try to really normalize these discussions, so that it's okay to talk about your feelings, even if they're negative. I hear this all the time from my patients and their family members. You know, they may feel nervous or upset or scared of how other people may react to their thoughts and feelings. I get a lot of comments like, I don't know, you might think I'm stupid, or, you know, this sounds crazy, but, and again, there's just that sort of a lot of support in terms of just, you know, sharing their feelings and their thoughts. And we all have our own thoughts and stereotypes about mental health that make it hard to talk about. So we may worry about how we seem to others, but also, you know, if I say it's not okay for me to feel depressed, it's not okay for me to feel anxious, then it's going to be less likely that I'm going to actually talk about it, right? And then sometimes people don't know what to do, like don't know what to say to somebody who starts talking about their thoughts and feelings. And one, they may not know much about mental health resources. They may not know much about mental health, period. And so if someone starts to talk about their feelings, they may just step back and say, okay, it'll be fine, don't worry about it, and then move on to the next topic, right? Because we don't know. And so I do like to equip people with how to respond to when people are talking about their thoughts and feelings. Okay, these are, sorry, the formatting's a little funny here. These are some other barriers to mental health treatment. I always like to give examples of thoughts about mental health and mental health struggles. Maybe you recognize yourself or someone else in some of these quotes. Very, very often, I get this one from my patients. I don't know how to describe how I feel. I don't know how to put it in words, right? Because you're experiencing the feeling, you don't really have the words to describe it necessarily, right? So that does take some practice and some education. Very often we hear people saying, I'm just having a bad day, I'll get over it. Eventually I'll get over it. That's fine, right? Or there's nothing wrong with me, it's everybody else who's upsetting me. Also hear this a lot. It's not me, it's them, right? But it's everybody, not me. Maybe I'm just stressed out. Maybe I should just sleep. I just need to sleep more and then I'll be fine, right? Thinking about, okay, I'll be fine if I sleep more versus if I feel better, then I will sleep more. I do unfortunately get this also a lot. I'm just being lazy, or they're just being lazy if it's a family member, talking about someone who may be depressed. Again, this is very common. There's no way I'm depressed. I have too much going for me. Why would I be depressed? That doesn't make any sense. And then, of course, if I tell anyone how I'm feeling, they're going to think I'm stupid or crazy. So these are very, very common barriers to mental health treatment, and recognizing that this is not going to help you feel better, right? And so that's why I think it is so important to recognize if, an older person, younger person, whoever is having these thoughts, that this actually is like a hurdle that needs to be overcome in order to feel better. Okay, so I'm going to give a couple of tips here on how you can stay mentally healthy, feel a little bit better about things, put things in perspective. Also, please feel free to share these with people you know. So I always say start with the basics. Take care of yourself, sleep, eat well, exercise, keep a routine, do things that you enjoy, go outside. Just be mindful of how much TV or internet you're watching, especially if you're doom scrolling or, I don't know what else, watching too much news, bad news. But keeping in mind that it's not just to have things to do, but remembering that good self-care boosts your health in general, mental, physical, and emotional health. Okay. Again, a couple of little tips for staying mentally healthy. I said just now, doing things that you enjoy. And if you think about it, it's not just, oh yeah, this is fun. Oh, it gives me something to do. But the more you do things that you enjoy, the more you're sort of injecting positivity into your daily life, right? And that is actually quite protective when you start to feel anxious or depressed. Having like little moments of pleasure is like a buffer. Avoiding alcohol and drugs. A lot of people, if they're stressed out or something, oh, let me just have a drink and, that'll relax me, that'll calm me down. Just keeping in mind, if, I say everything in moderation, but keeping in mind, are you actually addressing the problem when you're drinking or using drugs? And in the long run, it doesn't actually help you solve the problem. Look for help. I will give you a lot of resources. They are mostly New York City resources, but I will give you resources. I'm sure California has a lot of similar resources. And then doing even sort of simple exercises like deep breathing, can ground you and sort of slow you down. If you notice that your thoughts might be sort of racing, or just like you're just focusing on the negative or something like that, taking that break and just like focusing on deep breathing or any sort of grounding exercise can help you focus a little bit. And I always say this to my patients, it gets you out of your head for a minute, right? And gives your mind a break. Now, if you're able to sort of think about your thought process, notice if you're thinking negatively about things that you notice if you're thinking negatively and instead thinking about things that you can control instead. So if you find yourself saying, well, I can't do this, and there's nothing I can do about this, instead of saying there's nothing I can do about this, think about what you can control, because once you sort of get that sense of empowerment, then that resets, like shifts your mindset into like a more proactive way of thinking about things, as opposed to only focusing on the negative, which is not going to help you feel better at all. So this is a good question to ask yourself. How can I think about this in a more helpful way, right? If I'm just thinking, well, this didn't happen today and that didn't happen today, and that was another disappointment, this is not helping to solve anything, right? So how do I think about this in a more helpful way? I could think that, okay, well, that didn't go right today, but next time I'm going to do this because I know this is a potential consequence, right? Something like that. So thinking about like thinking forward, as opposed to sort of sitting in the past and thinking about, what didn't work. Okay, so I'm going to give, I know these are just Chinese, and I do have a couple of Korean resources that I didn't add on here, but if anyone is interested in self-help resources, there are several apps that are helpful, whether they're grounding exercises or even some sort of CBT, cognitive behavioral therapy based apps that help you sort of check how you're thinking, your thought process. Here are some websites on mental health topics. I always like to give a lot of resources to people so you can look around. And so if you decide that you would like sort of more professional help with mental health issues, step one, tell somebody, because if it's just you in your head, it's still hard. It's hard to manage on your own, right? So tell someone. It doesn't have to be a friend or family member. It can be a professional. You can see a mental health professional. It could be a psychiatrist, psychologist, social worker, mental health counselor, etc. And essentially what they will do is talk to you about how you're feeling. Very, very, very important. And I say this to everybody because yes, we can Google our symptoms and diagnose ourselves, but do not diagnose yourself. Rely on the professional to do it. I saw this really funny sign the other day, something about, yes, I trust Google more than my medical degree or something like that, right? Obviously rely on the professional. And so thinking about treatment, and it's, again, if you can sort of, separate from the stigma a little bit and just think about the goal, right? What is the goal of the treatment? The goal of the treatment is to help you feel better, right? In the end, bottom line is just to help you feel better, right? And in order to do that, you can change what is making you feel bad and then help you feel a little bit more confident that you can make changes. So if those are the goals, there's nothing wrong with that, right? So again, it's hard to battle stigma, and especially mental health stigma, but just if you just sort of like focus on the goal, and that's what it is, and whatever it takes to get you to that point, hopefully that can be helpful. I just very briefly want to talk about different types of mental health treatments for those who are not aware. Psychotherapy is talking with a therapist like myself about how you feel and how to feel better. There are a lot of different types of therapy: cognitive behavioral therapy, dialectical behavioral therapy, acceptance and commitment therapy, etc. There are different types of medications that work on different biochemistry that will help with various mental health issues. There are outpatient programs, which could be a clinic, it could be groups, it could be full day programs for people who need that level of support. And then of course there are inpatient programs, which is in the hospital setting for people who are having a very hard time functioning in their day-to-day life, and then they need inpatient hospitalization so that we can help them a little bit more intensively. Again, these are New York based, but these are some mental health clinics that we actually work very closely with here in New York City. They send our patients to our hospital. We send our patients after discharge to those clinics. And so they're very, they're also community mental health centers. So again, very devoted to AAPI communities. Here's some professional resources. They are, except for the 2 NYC ones, and On Track, these are national organizations where you can get services. Some of them are hotlines, and some, like Psychology Today and ABCT, helps you find a therapist, and you can actually you can search by zip code and insurance too. And then if you know anyone who might might benefit from coming to our hospital, we don't have an emergency room in our hospital, but if you go to these emergency rooms in New York City, you can request to be admitted to our hospital. We work very closely with community hospitals too and emergency rooms to route patients to our program. So that's about it for me. Thank you again for having me, and I welcome any questions.
Wonderful. Thanks so much, Dr. Chang, for this wealth of resources. I mean, an hour of your time is like hundreds of dollars worth of value. So thank you for sharing that knowledge. I'll give some time for the rest of people to collect their thoughts, but just to continue the conversation, I know I had one speaking from personal experiences on the topic of generational differences. So one traditional Asian value is family centricity, and kind of diminishing one's sense of feelings or needs for the goal of preserving the whole. And that can be compounded if people live in one house and maybe don't have private space, doors are open. So among your patients, do you have any guidance or recommendations on how to have gentle caregiver conversations, or how to kind of balance both of these values simultaneously as Asians in America, where there's one value system around independence and honoring your individual feelings, at the same time having the traditional Asian value of being part of a collective whole? So how can we manage those caregiver conversations across generations?
Yeah, I think this is such a good question, and it does come up, pretty regularly. I think it's family dependent, of course. I think, but also understanding and even providing a venue for family members to talk about their expectations and their values, because it may.
Ooh, that's a cliffhanger. Pause. That's such an interesting moment. We'll wait for Dr. Chang to come back. And when she does come back, we probably will have time for one more question before I turn it back to Noelle, if we're able to get her. If she's not able to come back, maybe we wrap up a little earlier.
Angel, maybe in the meantime, we can see if anybody has questions specifically about the Anise Health program.
Yes, that's a great point. So yeah, Anise is able to give care in California, New York, but I am here if anyone has any questions about Anise specifically. And Noelle, I know that you have experience working with or being part of our community. I'll just share some information. So all of our therapists identify as Asian. Our coaches are trained to focus on the Asian community. Clients on our platform get access to a curated resource library of dedicated and personalized articles, videos, and we're just glad to be able to facilitate peer connection. We'll be actually launching some peer support circles as well. So if people don't feel like they're quite ready for individual therapy or coaching, actually, if you complete the survey form that I dropped before, there's a way to actually be a part of our listserv, and then we will be starting these peer support circles where licensed clinicians will facilitate conversations around structured topics. And that will be a great way where you can still get to interact with a licensed clinician without feeling that you have to do our structured program.
I'm not sure if Nadine's going to come back, but I will say too, as Angel said, I'm very open about speaking about my experience in therapy. I've been in therapy a very long time, fortunately for me. And I recently started Anise as we started this partnership. So if anybody has any questions about Anise and the actual experience, you can ask them to me now. I'm also available via LinkedIn, Instagram, anything San Jose. I'm probably checking it anyways on NAAAP San Jose, but I just want to welcome everyone that it's a difficult decision to make if you don't have experience with it, and especially difficult if you are surrounded by family and friends that love you and support you, but don't support you seeking therapy. It can be really scary. I'll be honest. It can be really scary. It can be really disheartening to hear, like, to get over the hump of like, I do want that person on my side. I do want that help. And then everyone around you to kind of discourage that, right? So like I said, I'm opening myself up to anybody who wants to ask about Anise, or just, whether they want to seek therapy. I'm not a therapist or professional by any sense, but peer to peer, I'm very open about talking about therapy. It has absolutely saved my life, having that person in my corner. So I will absolutely plug Anise. It's a great program and it's very customizable, very affordable. And my last thing I'll say before I wrap up too, because I don't think we're going to get Nadine back.
Oh, actually, she just joined on her phone.
I'm here. I'm sorry. I'm on my phone now. I'm so sorry about that.
No worries. If anybody has one last question for Nadine, we will give it a minute, throw it in the chat or come off mute. I'll give it like 30 seconds for your chance, and then we'll wrap up.
Sorry about that. We had a big storm just now in New York, so I don't know if that's affecting Wi-Fi and everything.
So if anybody doesn't have any questions immediately, it's absolutely fine. If thanks, Jean, for joining. Thank you, everyone, joining. I'm just going to wrap up with the closing. If Angel and Nadine, you want to throw any other contact information in the chat for anyone who's still here. I know we had it earlier, but throw them in the chat. So in case you think of your question later, we're happy to connect you. Thank you so much to Anise. Thank you so much for Nadine. Thank you, everyone, for coming. Perfect. Thank you so much for putting contact information, Angel. Thank you for joining NAAAP San Jose. And if you have any, feedback or questions about our virtual events or in-person events, make sure to follow us on our Instagram, Facebook, LinkedIn. We're on all the things. And upcoming events. Today was our virtual one. This one, we hope to be able to do it again with Anise or other BFIT programs for NAAAP San Jose. We also have a monthly Storytelling 101 event, which actually will be happening tomorrow. All registration information is on our website as well as our Instagram and Facebook. We do that every month, every third Wednesday of the month, just no experience necessary for Storytelling 101. And then we also do in-person networking dinners because we all love to eat. And that is generally the fourth Wednesday of every month. And we move it, kind of Marika talked about it earlier, but we move it all around the Bay Area, okay? So we try to mix it up and get different kinds of food and see different people at different locations. We also are starting a quarterly dim sum. We wish we could invite all of our East Coast people. If you're ever on this side, please come and join us for a dinner and dim sum. We have a great time just eating, meeting people, and it's an absolute pleasure getting to talk to our members. We also launched a Slack channel recently. I know, so much information, but we're trying to just connect with everyone. Everyone's still trying to, rebuild our community. So please follow us on our socials as well as our website for upcoming events. And we're just so excited to see everyone. We hope you got amazing information today, and we'll consider, a NAAAP program or therapy program for yourself if needed. And we're always here to answer questions and continue to build this community and be there for you in this community. That's pretty much it. Thank you so much for joining. If anybody has any questions, like I said, please save those emails and follow all of us. We loved having you. Thank you so much. Thank you again to Anise. Thank you so much to Nadine.
And we will be posting this on our NAAAP San Jose YouTube channel. So we'll be sending off information for that. So if you want to share this with your friends, with family members, with other people, by all means, please do so. So we'll have a notification going out with the link for that.
Thank you so much, everyone, for coming.
Thank you, everyone.
Good one.